I know the two compliments. One is that conference starting in time. Normally it doesn't happen. In the Delhi, you start dot at time at 10 o'clock. That is one. Second is, I can see the top management leadership, middle management and young leaders coming under the one roof. I think this is another compliment to the ET. Now, because the time given to me was just to set up the context, because talking is to be done by senior leaders after me. So I have to set up the context only, and for which actually I have got 10 minutes now as per the time. So I'm keeping my watch here. Okay, now the topic for the context setting is affordability versus sustainability. So far we have been talking about affordability, which actually came from the universal health coverage. The universal health coverage has got four components: making healthcare available, accessible, affordable, and acceptable. Now, these are the four components around which all the nations are struggling at this point of time. India, as far as availability is concerned, with a 21 lakh beds, out of which 13 lakhs are in the private sector, around 9 lakhs are in the public sector, we are half the mark, because we are around 1.5 beds per 1,000 population. We need 3 minimum per 1,000 population. That is one. Accessibility, huge problem. Karnataka has got 4.2 beds per 1,000 population. Bihar has got 0.3 beds per 1,000 population. That is the kind of diversity in this country. So somebody was asking me where to invest. I said invest in Bihar, because that is the place where it needs the beds at the most. So that is the accessibility in problem. Now, you see, people keep talking, the inflation. My topic has been given healthcare inflation, because people keep talking about that healthcare cost is increasing. I want to just remind, which I keep telling government also many times, that the life expectancy of India at the time of independence was 37 years. Actually, it was less than 37 years. Today, it is 73 years. How it has happened? It has happened only because advancement in the healthcare. And when you do advancement in the healthcare, obviously the diagnostic, the cost, the one proverb which I used to apply when we created NABH, that the healthcare will cost. Quality healthcare will cost. Absence of quality healthcare will cost the life. I think that is the difference people have to understand. So anyway, now, this is settling now. In government, whenever I go, Niti Aayog or in the NHA, they nowadays keep saying one thing, that very, very fast we are going to cover, rather we are already touched upon 70% of population under some or other medical cover. They cite 40% of population through Ayushman Bharat, another 9% through the central government health scheme, now 6% through the senior citizen, and around 20% through the private insurance, and other few insurance, coming up together, we are touching 70%. Of course, if it was true, it is a good achievement, but to be very frank, we have not even covered 30% of population under Ayushman Bharat. That means issued the card, not 40%, that is one. And even those who are having the cards are unable to access the health care because of the reasons we know about. Recently, state after state is, coming out, falling out from the Ayushman Bharat for the reasons which I will not dwell. I think people are going to talk about in the time to come. But I will touch upon more important subject today, that the way government is saying that we are covering 40% plus 9% plus 6% through their own scheme, the private insurance also is playing very important role. And recently, there has been a serious dialogue going on between the providers and insurers. And one of the points we found that if we have to be affordable, that means we have to improve our own efficiency in the healthcare. I think all our hospitals today are green most of the time. They are applying lean healthcare. They are applying all quality tools to improve the efficiency, management, design of the hospital. At the same time, we pointed out to the insurance company that your medical loss ratio, is too high. In fact, they are spending 35 to 40% of the premium received on the administrative cost. This is mind-boggling figure. In USA kind of country, it is not more than 10 to 15%. In Germany and France, it is less than 10%. So I think we are telling insurance company also now to pull up the socks, improve their efficiency, cut down so that the money premium collected is actually utilized by the providers. The way we are getting a lot of problem from the government insurance scheme, same thing is now happening in the private insurance scheme. The kind of deduction rates of 2017 are even prevailing today. So I think these are some of the problems which we'll have to sort out. So there is a government insurance, there is a private insurance, and we are the providers. All three of us are responsible for ultimately the patient usually. But I think the time has come, the kind of technology which is coming, and the kind of awareness, consciousness is coming. I think I am seeing the time is not far that, in fact, our Honorable Prime Minister said once that 2047, I want to see India being the Vishwaguru in healthcare. And that actually was repeated in a number of the conferences. Now, for that to happen, three things have to be done. One, that means we have to double the number of beds. That is one. That is little easier, I will tell you. But more difficult is to make sure that each state and each district has got 3 beds per 1,000 population. It should not happen that even in Karnataka, when I said it is 4.2 beds per 1,000 population, in fact, in Bangalore it is 5.6. So that means the rest of the district, I'll give you another example. Telangana, because in our own directory of AHPI, Telangana has 126 hospital with 100 bed and above, 126, out of which 118 are in Hyderabad. So you can imagine the people from Telangana, all of them have to come to the Hyderabad. Number 2, we have told government that 85 to 90% of tertiary and quaternary care beds are in the private sector. And they are largely in tier 1 or tier 2 town. So government has to come out aggressively, very aggressively, to incentivize private sector to set up the hospital in tier 3 town. In fact, Honorable Prime Minister in 2018 itself had announced that he wants to see 3,000 new hospitals, 100 bedded in tier 3 towns. Unfortunately, that has not happened because no incentivization has been provided. So that is the point number 2. Point number 3, of course, is this is chicken and egg story. If you have to set up the hospital in tier 3 town, you need a specialist. And number of specialists, I know, recently, number of seats have been increased, but that will take another 3 to 5 years to make available the number of specialists who are ready to go, who will rather go to tier 3 town. So there, government has to again, NMC or NBE, they have to come out with the very aggressive schemes. Maybe fellowship, not necessarily wait for the MD. For example, in stroke management, we found a huge shortage of the people who can attend to the stroke emergencies. So we have to come out with the kind of aggressive fellowship program to make good the shortage which is now. So these are the 3 important things which are going to happen. Finally, I will tell you why there is huge cry among the society that healthcare is expensive. It is for the simple reason that they keep seeing that government is providing free healthcare. Now, none of us actually has done firstly the calculation of the delivery of the healthcare procedure, number 1. So I have told 3 state government, which they have agreed now, that please start billing the people who are coming in the government hospital. And we have given formula to these 3 state government that per day, per bed cost. For example, one state is coming 7,500 general ward. I said, okay, 7,500 into 3, bill it for 3 days. Subsidy, same amount, 0. At least people will come to know that what is the cost of delivery of the healthcare in government sector. When they come to Fortis or when they come to Apollo or when they come to Devilina's hospital, then they will know that if they are charging little more, but that is the kind of personalized service they are providing, this, I think, the impression of that this private sector is expensive will go. So I think all put together, my role was to set up brief context around this point, our senior leaders are going to speak. Thank you very much.